Welcome to Dr. Mensch, the radio show that takes a real, compassionate look at mental health from A to Z. Join child and adolescent psychiatrist Dr. Gil Lichtshine each week as we explore topics that matter: autism, ADHD, anxiety, depression, OCD, schizophrenia, behavioral challenges, neurodevelopmental disorders, and more. No stigma, no judgment. Just honest conversations, new therapies, breakthrough treatments, and real solutions for real people. Mental health is not a weakness. It's a treatable medical condition, and help is available. Join the conversation now by calling the studio at 888-994-4995, Studio A. This is Dr. Mensch, where hope and healing begin.
Good afternoon, everybody. This is Dr. Gil Lichtshine, aka Dr. Mensch. It's a beautiful Monday afternoon here in Boca Raton, Florida. I'm a board-certified child, adolescent, and adult psychiatrist with my office in Boca Raton at 7100 West Camino Real, Suite 404. My phone number is 561-300-4052. Last Monday, I had a guest, a patient of mine named Andrew, who came on the program to explain his experience with treatment with intranasal ketamine, and we actually administered one dose and explained a little bit about what ketamine is and what experience he's had with the treatment that he's had for about three years, and what impact it's had on his life. And today I kind of want to follow up on, not necessarily on ketamine, but talking about some other alternative, I don't want to say alternative, or let's say this specific treatment, a non-pharmacological treatment for depression called transcranial magnetic stimulation. And interestingly, I had spoken at a conference last week in Tampa. It was a conference for primary care physicians, but one of the topics was different mental health issues. So one of the topics I had spoken about was on the use of psychedelics and TMS in treating depression and PTSD, and a lot of the primary care docs in attendance and were streaming online were very interested about kind of these newer alternative treatment options, because if you go back 15, 20, maybe 20, 30 years and longer, really the only options were traditional medications, but not every patient falls in this neat little box and responds to the first or second medication you try for whatever their condition is. And often you'll have patients, lots of patients who have not done well and typically would be prescribed a myriad of medications. It's called polypharmacy, to try to help them deal with what's going on. But I would say in the last 15 years, we've had a different or new treatment approach for depression called transcranial magnetic stimulation, which is a form of, it's called neuromodulation, which basically is like the branch of psychiatry that is involved in altering brain functioning, and that the brain is an organ that kind of learns, and that we can do certain techniques and maneuvers that could actually enhance the brain's resilience, the brain's ability to learn and resprout itself, so to speak. It's kind of like no different than when patients have had strokes and they go through kind of cognitive therapy or cognitive rehabilitation, trying to get that part of the brain that was impacted by the stroke back to kind of close to or to where they were prior to the insult. So TMS is a form of neuromodulation, and the premise behind it is TMS uses a MRI strength magnetic coil that's applied to a particular area of your head or your brain, and it delivers repetitive magnetic pulses through either a helmet or a coil, and for a specific amount of time at a specific intensity. And what that does is it actually causes the underlying brain circuitry to start firing. It's kind of like putting in like if you had one of those fuse boxes. Now most are circuit boxes, but if you had these fuse, it's kind of putting in a new fuse or a new circuit to energize or turn on a circuit that that misfired or malfunctioned. And it relies on a principle in physics called Faraday's law, which basically describes the concept of electromagnetic induction, which basically means that if you apply a changing magnetic field to some surface that conducts electricity, in this case the brain, and the changing magnetic field is this coil that delivers these pulses, it will induce an electrical current. And the brain is an electrical organ, and the different regions and lobes and circuits in the brain communicate through electrical impulses. So what TMS does is it's a non-invasive, non-pharmacological treatment for depression. I mean, that's what it's FDA cleared for, but it's also used to treat OCD, and there's also a lot of data that it's very helpful in post-traumatic stress disorder, anxiety disorder, substance use disorders, and smoking cessation, and a few other conditions. But the benefit of TMS is it's a targeted, localized treatment that really has few side effects. It's kind of like the analogy I give to patients of let's say taking a medication for depression versus TMS. Medication is kind of like analogous to an open appendectomy. Back in the day before laparoscopes, you'd have to to get your appendix out, you'd have to open up your abdomen and take the appendix out, and you'd have this big scar. And being that it's a more invasive major surgery, there could always be complications, and it's not like that you would go home the same day, maybe not even the next day. You might have to stay a few days in the hospital after getting appendix out. But now you have these appendix, gallbladder, a lot of other abdominal surgeries that can be done laparoscopically, where you have these minor little incisions for the scope that don't have any scars. There's no big incision. And depending on the procedure, you might be able to go home the same day, or certainly maybe only spend one night in the hospital. There's a lot less complications. So I kind of equate medications with like an open appendectomy, and TMS being more like a laparoscopic appendectomy. TMS being much more targeted, localized, and having less side effects. Now, even though in the grand scheme of things, the ultimate impact of taking a medication, let's say Prozac for depression, and doing TMS for depression, kind of in the end yields kind of similar, outcomes, or in terms of the cellular level, what it does, the means to the end are different, and that's where you come in terms of, like, for example, side effects. So, for example, you take Prozac, and it's what's called a serotonin reuptake inhibitor. It blocks the serotonin transporter protein. It allows for more serotonin to hover around in the synapse, or in the space between two serotonergic nerve cells, and it allows serotonin then to bind to its various receptors on what's called a postsynaptic neuron, and lead to a cascade of events. Now, part of the problem is some of the serotonin receptors that the SSRIs facilitate serotonin binding to also cause some of the side effects, like the sexual side effects, and then serotonin effects in the GI system lead to, for example, nausea and diarrhea and GI effects. TMS, so what it does is you put this coil, or depending on, there's one machine where you wear a helmet and it delivers these pulses, and it targets a specific circuit in the brain called the dorsolateral prefrontal cortex, which is in the kind of front lateral part of the left side of your brain, and it causes it to fire and kind of like turn on the circuitry and lead to kind of a cascade of cellular events. But it's not doing so by promoting blocking the reuptake of serotonin or dopamine or whatever other neurochemical. It may result in greater production of serotonin intracellularly, but not what's called extracellularly. So you don't have serotonin binding to these different receptors, and hence you're not going to have the sexual side effects or the sedation or the gastrointestinal side effects that you might have from different, antidepressants. So that being said, that's why, TMS is a more localized, non-pharmacological, non-invasive treatment. You're not under general anesthesia. This is an office-based procedure. Now, if there's one drawback is it's a daily treatment. It's not something you do one time. You come into the doctor's office, and the standard treatment for depression is about 18 minutes, 45 seconds. You do it Monday through Friday, typically 36 sessions. So we're talking about, it's about 8 weeks, because the final few treatments are kind of like taper down. But since you're not under general anesthesia, there are no restrictions. So you could do the treatment, let's say at the beginning of the day, end of the day, and go to work, or you could do it during a lunch break. It's not something that's going to put you out of the day for work. Now, the good thing about TMS too is there are other type of protocols that can be used. One of them particularly that shortens the treatment to about 3 minutes, and I will expound on that after a brief commercial break.
What happens when the mind of a healer crosses over into the darkness of the human soul? From authors David Icovetti, Dr. Gil Lichtshine, and Yolanda DeLuca comes a chilling psychological thriller, Dr. Mensch, A Prescription for Evil. This gripping novel follows a respected Boca Raton psychiatrist who secretly descends into madness, transforming into a modern-day king of the underworld. Inspired by true events and Dr. Gil's childhood connection to a mob family, this story blurs the line between sanity and evil, genius and destruction. Unforgettable, disturbing, impossible to put down. Get your copy today on Amazon.com. Dr. Mensch, A Prescription for Evil, a 2020 psychological crime thriller. You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshine. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show.
Hello again, this is Dr. Gil Lichtshine, aka Dr. Mensch, back continuing to talk about TMS. And before the commercial break, I started to talk about that the treatment is a daily treatment for 36 sessions, Monday through Friday, and that the standard treatment for depression is a little under 19 minutes. But there is a more accelerated treatment called theta burst, which is a little bit more of an intense treatment in terms of the amount of pulses delivered at any given, at a given time. That lasts about 3 minutes and 20 seconds. And so if a patient opted to do that treatment, you're in the chair for 3.5 minutes and off you go. And then there are other what called accelerated protocols. One's called the SAINT protocol, was developed in Stanford University, which is kind of theta burst on steroids, where you do 10 theta burst treatments a day for 5 days, and then you're done. And then there's another, which that's FDA cleared. There's another protocol that's not FDA cleared. It's called it's like a, I don't know the exact name of it, but it involves to improve neuroplasticity. The patient is given a dose of D-cycloserine and I believe 200 or 250 milligrams and a 20 milligram dose of lisdexamfetamine or Vyvanse about an hour before the beginning of this treatment. And then they do 20 theta burst treatments in one day. So basically you're at the doctor's office for about 10 hours and you do a theta burst treatment on the hour and half hour for 10 hours, and then you're done. So there are ways around, in terms of, it's going to last for 8 weeks, or you could also do 2 treatments, whether theta burst or regular treatment, or the standard treatment or protocol a day. So you can be done with the treatment in like about 3 weeks' time if you do the theta burst or the standard treatment. So, this idea of, wow, it's time consuming, it's true, but there are ways around where you could accelerate getting through the 36 treatments a lot sooner. So if you do two a day, essentially you're coming for 18 days. It's basically 3.5 weeks. Or if you decided, I'm going to do it, each 6 days a week, you could do that, so you're done in 3 weeks. So there are ways around it. Like I said, the good thing about this treatment is that it doesn't have any restrictions or limitations, and you could just go about your day, go to work, go about your day, daily activities. You don't need someone to drive you for the treatment. You could drive yourself. Because you're not under general anesthesia. In terms of theta burst or the standard treatment, both are equally effective. I would say why would one do one versus the other? Maybe for time constraints. You could intermix and do a standard treatment one day, a theta burst another day. You could add the theta burst to your standard treatment. So again, there's a lot of combinations here. TMS is very effective. Data shows that 1 year, that after someone's completed what's called an acute treatment of the 36 sessions, that there's about an 85% response rate a year out and about a 62% remission, which is pretty good. If someone has a relapse, you could go do another round of TMS. Even though this is not FDA cleared, I usually recommend patients continuing what's called maintenance or preservation TMS, where after they finish the acute treatment course of 36 treatments, to continue with some type of maintenance regimen, which again, there is no consensus in terms of what it would be considered maintenance, but some might do 2 treatments a week, or a treatment a week for several months, then taper down to a treatment every other week. Some consider doing like a burst of, let's say, 10 treatments over 2 weeks and then stopping. So there is no like universal consensus of a single maintenance regimen, but some type of maintenance treatment probably is what I would recommend for someone who has responded and is in remission. If for some reason they can't do it, either because of time or cost, I would say continue with whatever treatment you were getting prior to the TMS. Now, in terms of cost, when I first started doing TMS in 2013, no insurances were covering it. So it was entirely, fee for service, and it was, out of pocket. It was quite expensive. We're talking about $15,000 for the full course of treatment. Nowadays, most, if not all, insurance plans cover it. It might require what's called prior authorization. Some insurance plans have certain requirements, like you've had to been on X amount of medications or done therapy. I know what I've learned is one insurance plan, I think Cigna, doesn't even require prior authorization, and that you can just start a patient on TMS without needing insurance approval, and they'll automatically pay for it. So TMS has become more affordable to patients because most insurance companies now pay for it. There are a number of TMS devices out there. When I first started doing TMS in 2013, at the time there were only 2 devices available. NeuroStar, that was produced by Neuronetics based out of Pennsylvania. That was the first machine. Then Brainsway, a device that was developed by Brainsway in Jerusalem, in Israel. But since then, there's been, a number of other MagStim, MagVenture, Cloud TMS, Apollo TMS. I mean, there's probably at least about a dozen TMS, devices out there, and they all have their, kind of nooks and crannies and their pros and cons. But I think, that they're all equally effective. Obviously, if I was here being paid by Neuronetics, I'd be telling you NeuroStar is the best treatment. But I think that they all have their pros and cons, and might be also why you might choose one over the other is, what device is readily available where you practice. Here in South Florida, I mean, we have the luxury where, a lot of these TMS companies have reps down here, and you can easily get those machines. But if you're, let's say, practicing in a more rural area, I know, for example, like NeuroStar has pretty good customer service. You might want to have you might go with a company that has good customer service that could readily deal with some issues. Let's say if you especially practice in a rural area. In terms of when to consider TMS, the indication is for someone who's failed at least one antidepressant trial. Certainly would offer it. If someone came to my office and said, "Hey, I want TMS as a first-line treatment. I don't want to take any pills. I'm not a pill taker. I don't do drugs, any of that stuff." I'm like, that's great. However, under those circumstances, most insurance companies probably wouldn't pay for it. So the person would have to pay out of pocket. But, if that wasn't an issue, to me, having TMS as a first-line treatment is something that I think should be looked at. But in reality, if someone was on a standard or a therapeutic dose of an antidepressant for 4, 6, 8 weeks and is not getting any better, TMS should be a consideration, and there are a lot of potential benefits to it. Now, one thing I do tell patients is I never promise, one, that it's going to work, because I can never guarantee anything, and 2, it's not a replacement for medication. It's not instead. It's not like, well, if you are on Prozac, you can't do TMS or vice versa. They often can help each other. Same thing, ketamine and TMS. Ketamine is a medication. What I tell patients, especially ones who are on a multitude of medications for depression, I say, I can't promise that we're going to stop all your medicines, but doing TMS might result in having some of your medicines consolidated, maybe some of your doses lowered. Maybe you're on 5 medicines, maybe we can eliminate 1 or 2. I never make the promise like, oh, I guarantee that this will result in you being 100% better and we'll get you off Prozac. I say it's a possibility. Patients ask me, what happens when we're done? And or what happens when we finish? And I explain to them, okay, the possibility of what's called maintenance treatment, or not doing maintenance treatment and just continuing with the treatment or therapy or both that you had, before TMS and that you were continuing while you were doing TMS. So again, there are a lot of options to consider. I try to keep the patient kind of centered in the here and now, as opposed to worrying about what could happen 6 weeks or 8 weeks from now, because who knows what could happen 6 or 8 weeks from now. But my take on TMS is it's I don't want to say promising. It's been around. It's been used now since 2008. So we have tons of data, and it's now being applied to. In Europe, the BrainsWay device is cleared by their Europeans version of the FDA for Parkinson's, Alzheimer's, neuropathic pain, post-stroke rehabilitation. Here it's for smoking cessation, OCD, anxious depression, and major depression. In Europe, it has an indication for schizophrenia, for bipolar, for post-traumatic stress. So there's data in ADHD and autism. Even in tinnitus or ear ringing. So this is a treatment that's safe, effective. What I try to tell patients, it's not a medicine, so it doesn't have the side effects, of a medicine. It's not something that necessarily is going to work instantaneously. Some patients, it works pretty quickly. Some it might take till they're midway through the treatment, or even sometimes towards the end of treatment. But I'd say primary care physicians who have patients with depression and not responding, consider, TMS, go to any meetings, professional meetings that might talk about it, learn more about it, and realize that this is a pretty viable, safe, effective treatment for a very debilitating, illness. And on that note, I will wrap this talk. This is Dr. Gil Lichtshine, aka Dr. Mensch. I wish everybody have a pleasant rest of your Monday and a great rest of your week. Thank you very much.
Thank you for joining us for Dr. Mensch with Dr. Gil Lichtshine, helping you navigate the world of mental health with clarity and care. If you or someone you love needs support, you're not alone. Treatment works and recovery is possible. To schedule a consultation or discuss non-medication therapies, personalized treatment plans, or psychiatric care, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. You can catch us each week on South Florida Oldies Radio and streaming across all social platforms. Until next time.